Now, health experts in the country are warning that the fight against HIV and AIDS is facing a new threat after 20,000 new HIV infections and 21,000 AIDS-related deaths were recorded in 2024. Speaking in Nairobi ahead of this year's World AIDS Day celebration, National Syndemic Disease Control Council CEO Douglas Bosire said the country must urgently prioritize adolescents, youth and mothers to end AIDS by the year 2030.
3, 2.
Kenya's HIV response actors met in Nairobi on Friday during the launch of awards to recognize journalists' contribution in the war against HIV/AIDS in the country. Speaking at the event, National Syndemic Disease Control Council CEO Douglas Bosire sounded an alarm over what he termed the worrying increase in HIV infections among young people.
41% of the new HIV infections among adults in the year 2024 was among 15 to 24. However, if you broaden that bracket again to 34 years, 75% of the new adult HIV infections occurred amongst those aged between 15 and 34 years.
He also warned about the increase in the mother-to-child transmission of the deadly virus.
In fact, you have 7 counties up there, up north, who had mother-to-child transmission rates of above 20%.
Let us claim the HIV narrative, elevate the national conversation, and together achieve the goal that we need to end HIV, particularly among adolescents and young people, and to the future we desire of an AIDS-free generation.
Speaking at the event, NASCOP head Dr. Andrew Mulwa said Kenya's HIV response systems were highly hampered this year following disruptions in donor-supported supply chains and drug delivery. He emphasized the need to move away from fragmented HIV, TB and malaria services towards a unified system which offers patients comprehensive care in one location.
As a Ministry of Health, our primary responsibility is to develop guidelines, standards and policies for management of HIV. Currently, we are reviewing our treatment guidelines, and this year's guidelines are not just guidelines for HIV.
Joseph Ohungu for Easy Friday.
That's the microsite.